Scientists have yet to yield the ability to predict a person's exact lifespan. But what if I told you something as simple as your zip code could be the key to figuring out the longevity of your life? Let's take two people. Randy and Omar both live in Chicago. They both come from a family of two parents. The only difference is that Randy lives in a nice part of the neighborhood of Edison Park, and Omar grew up in Riverdale. Randy is expected to live up to the ripe age of 90 years old, while Omar is expected to live up to 60. A full 30 years difference. But why is that? What we're talking about here is the social determinants of health. Where you live, work, learn, and play have a huge impact on your health risk, and more importantly, your life expectancy. This includes things that we often can take for granted, such as safe housing, proximity to grocery stores, schools, job opportunities, and exposure to pollution. So what causes these large disparities of lifespan to exist in the same city? Well, for starters, large cities like Chicago have greater segregation by race and ethnicity, with predominantly minority neighborhoods often facing obstacles like poverty, unattainable housing costs, unemployment, and subpar social services. Social determinants, like I mentioned before. This can be traced back to a practice in the 1930s called redlining, a systematic denial of various services by federal government agencies. For decades, many banks in the US denied mortgages to people, mostly people of color in urban areas, preventing them from buying a home in certain neighborhoods. So while Randy can benefit from generations of wealth passed down from his family, Omar is left starting from scratch. In 1930, Chicago neighborhoods containing black residents were marked as Class D. Regardless of black residents' income, and no matter how small a proportion of the area's total population was black, the FHA ensured no loans could be made of either purchasing or upgrading properties in these red line areas. These factors created two radically different housing economies in Chicago. Highly limited and relatively costly housing options for African Americans, and affordable housing options for white Americans with similar income. Now, redlining has since been prohibited by the US government. However, the effects can still be seen today through a correlation between zip code and life expectancy. The inability to access good health care, the severe stress of maintaining your housing can all affect your health or lack thereof. For example, in general, diseases of the heart are the #1 killers of Americans. However, while the rate of heart disease has been steadily decreasing among white Americans since the 1970s, the rates are not decreasing as sharply among African Americans. Everything's connected. Heart disease comes from your stress level, your diet, your lifestyle, and most relevantly, where you live and what you have access to. Our systems are impacting our health. This did not happen in a vacuum. Racist actions perpetuated and designed by our government are negatively affecting people of color's health, and specifically African Americans to this day. We need to use science and history collectively to meet at the point and where our institutions have failed us. So what may seem like a history lesson is ultimately a health issue.